I'll be demonstrating shoulder examination maneuvers that are a result of our consensus-based survey study done by Rheumatology Fellowship Program Directors aiming at Rheumatology Fellows training. These maneuvers are a result of our consensus-based study that aim to create a comprehensive list of maneuvers that to be done and taught when approaching to a nondescript shoulder pain at a rheumatology clinic setting. And I want to note that these maneuvers are the ones that we found consensus on and does not include all the comprehensive list. Now I will be demonstrating our Tier 1 exam maneuvers, meaning that they should be taught all the time and they should be performed all the time when approaching to nondescript shoulder pain at rheumatology clinic setting. Today I will start my Tier 1 maneuvers with the inspection of the shoulder. I have adequate exposure of the both shoulders. I'm inspecting for any asymmetry, any swelling, any deformities or alignment issues. I'm inspecting the clavicle, an acromioclavicular joint, and the glenohumeral joint itself. And then I'm moving to laterally and posteriorly. I'm inspecting for the deltoid muscle bulk, and I am inspecting for the scapular spine, and then the suprascapular fossa and infrascapular fossa to see if there's any muscle atrophy or hypertrophy. Then I will transition to my palpation maneuvers. So I will start by palpating the sternoclavicular joint here, and then track along the clavicle, and then feel the acromioclavicular joint and the acromion, and I will ask my patient to shrug the shoulder against my hand. Yep. And then I will continue palpating the acromion and the borders of acromion. And then I'll be palpating the glenohumeral joint to see if there's any major effusions by doing anterior-posterior palpation technique to see if there's any bulging with major joint effusions. Lastly, I'll be palpating the biceps tendon, long head, and then while doing that, I'll be doing dynamic internal and external rotation of the shoulder to feel the sliding movement of the long head of the biceps tendon. And now I will do my passive range of motion maneuvers. So I will start by abduction of the shoulder to 90 degrees at the scapular plane to 90 degrees. And then I will do internal rotation to 90 degrees and external rotation to 90 degrees. And then I will do forward flexion to 180 degrees. Lastly, I'll be doing cross-arm adduction test for the AC joint pathologies. Now I will transition to active range of motion maneuvers. So I'll ask my patient to abduct the arms to 180 degrees like I'm doing. And now I'll be inspecting for the presence of painful arc. And all the way down. And then if you can raise your shoulders all the way to 180 degrees. Okay, good. Now put your elbows at your sides and up your hands, open them, and then just move them with the keeping the elbow at your side, move them externally and internally. Okay, and now we will do the resisted testing. So I want you to keep your elbows there, and I want you to resist me. First, I want you to push out against my hand. Good. And then push in. Good. Okay. And then now I want you to do resisted abduction of the shoulder. So I will ask you to open your shoulders against my hand with all your strength. Okay. Good. Now we will do empty can testing. So I want you to do thumbs down and put your hands like this at the scapular plane. And now I want you to resist me while I'm applying downward pressure. So 1, 2, 3, resist. Good. And now I will do a Speed's maneuver. So I will ask my patient to strengthen the elbow and then up the palm and apply. I will apply downward pressure, so I will ask him to resist me. Push up. And that's the Speed's test.